So, I mean, a great example is the going up to the ICU to perform a procedure on a patient. And that's a fairly common occurrence for us. We're up there quite a bit doing multiple different types of procedures, but the bottom line is you have to be very close to the patient, and some of them can cause the patients to cough or generate aerosols, which is one of the things we worry about. So all our ICU rooms were adapted for COVID. And so it was, those adaptations took up a lot of square footage and a lot of space in the ICU room itself. And they became quite cramped, even more so than they were to start. And so almost everything I do in ICU requires ultrasound guidance. And so I would, we'd cart up these huge machines with big footprints, heavy, hard to navigate around all the tubing and IV poles that are in the way. Their beds are big in ICU. And so we'd be like cramping ourselves into this tough little spot and trying to perform a procedure where I wasn't comfortable in my ergonomics because of necessity. I was trying to like squeeze into these little spaces. And so you compromise your procedure a little bit, or you hurt your own body at the end of the day. You're sort of feeling a little, need a massage or something after. And so that was one of the difficulties. And to be honest, like COVID didn't really, it wasn't only COVID that did that. We were doing this to ourselves anytime we went up there because of the small rooms. It just kind of highlighted, because now you're also in N95 and a mask and goggles and, double gloved and 2 gowns. And it's just, you were just feeling uncomfortable and sweaty by the end of it. And all for something that if it wasn't COVID and we were down in our department, it would just be a simple little thing.